Question 67, the urinary bladder. This is the urinary bladder. It is a reservoir of urine, and when it's empty it's placed in the pelvis, and as it fills it expands into the abdominal cavity. It has an apex, neck, fundus and a body. The fundus is directed down and backwards, and in the male it is related to the rectum, connected to it by a rectovesical septum containing seminal vesicle and deferent ducts. Inferiorly, the fundus is related to the prostate. In female, the fundus is related to the uterine cervix and vagina, and it is connected to them by vesicovaginal septum. The neck is the lowest part of the bladder. It is the most fixed part, and it's connected to pubic symphysis and to the rectum by pubovesical and rectovesical ligaments. In female, the neck is surrounded by the upper part of urethra, and in the male it is related to or directed to the base of the prostate. The body is the middle part of the bladder. It has an anterior, posterior and inferolateral surfaces. Anterior surface is related to pubic bone, connected to it by retropubic fat. This is areolar tissue containing venous plexus. And as the bladder fills, the anterior surface becomes in contact with the anterior abdominal wall. The posterior surface in male is covered by a peritoneum. It is in contact with the rectum, separated from it by a rectovesical pouch. It is also in contact with sigmoid colon and coils of ileum. In the female, the posterior surface is also covered by peritoneum. It is in contact with body of uterus, separated from it by vesicouterine pouch. Vesicouterine pouch. The inferolateral surfaces of the bladder is related to the pelvic diaphragm, or the levator ani muscle. See, this one is levator ani muscle. Here you have inferolateral surface of bladder. The apex of the bladder is directed upwards, and the median umbilical ligament is continued from it to the umbilicus. Median umbilical ligament. The wall of the bladder consists of a muscular coat, a mucous membrane, and a serous coat. And then on top of here you have peritoneum in addition on top. The mucous membrane is loosely attached to the muscular coat, and it is folded into mucous folds, which disappear as the bladder fills. The bladder will expand. And on the inferior you have a trigone, which would be here. The borders are the ureteric orifices and the orifice of urethra. and here the mucus is smooth and it is firmly connected to the muscular coat underneath. And the orifices of ureters are connected by interureteric crest. And it is a mucus fold elevated by muscle fibers of ureteric wall. The muscular coat of bladder constitutes the detrusor muscle. So the detrusor muscle is composed of 3 layers of internal plexiform, middle circular, and external longitudinal. And then you have sphincter urethrae internus, or internal urethral sphincter, which is involuntary. And this is derived from the circular layer of detrusor muscle. And from the external layer of muscular coat you have rectovesical and pubovesical muscles that are derived from the external layer. The blood supply of urinary bladder. You have superior vesical artery from internal iliac. You also have inferior vesical artery here. So superior and inferior vesical artery. And the nerve supply is by the vesical plexus, where you will get parasympathetic fibers for detrusor, the entire urinary bladder, and sympathetic fibers for sphincter muscle.